Seth Pop was diagnosed with oligoarthritis. It impacts fewer than 5 joints in the first 6 months of the disease and can lead to eye inflammation, damaged vision, and further joint pain.
Until that time, I didn't know kids got arthritis. And, you know, of course, we were scared to death because he couldn't even see the big lighted E across the room with his left eye. We had no idea he was compensating. He was basically blind in his left eye.
Seth's condition often presents itself in young patients who are unaware of a decline in their vision.
It is also the most common cause of long-term chronic inflammation in the eye that involves predominantly the front part of the eye. So it is important for the parents to be aware that any joint problems in kids can be associated with problems elsewhere, one of which would be eye involvement.
Oligoarthritis impacts almost half of children with juvenile idiopathic arthritis.
It is a manageable condition. It is a long-term condition. It requires regular follow-up examinations. Unfortunately, we don't have a cure for the condition. So we know that it's a chronic condition with most likely recurrences and relapses.
Treatment for juvenile arthritis can include medication, physical therapy, eye care, and proper nutrition. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan. Catherine Wildman was told she had high cholesterol at age 15. After suffering a heart attack at 38, doctors diagnosed her with familial hypercholesterolemia.
That is not an unusual story. So people with FH, you can actually test them at birth. You would be able to tell if they had FH. So we have high cholesterol that builds up our entire lives.
First-degree relatives have a 50% chance of having FH. When a patient is diagnosed, doctors suggest cascade screening of their family members.
When we find a child who has extremely high cholesterol that is diagnostic of FH, we can predict that one parent, half of their siblings, half of their other first-degree relatives, and a quarter of their second-degree relatives will have the disease. So cascade screening means that we should screen all of the family members so that we can diagnose the problem before it becomes a problem.
1 in 500 people has FH. 90% are unaware they have the disease. The FH Foundation is creating a national registry to help patients identify if they have a relative with the disease.
The one thing about FH is, unlike many other diseases, it's very exciting, even though it's scary to find out, because there exists today treatments that help us manage it and can almost equalize our lifespan. So in other words, individuals with FH have 20-fold the risk of an early heart attack. But if you treat them early and find them early, you can help them to have a normal lifespan. So there's a lot of hope.
To see the National FH Registry, visit www.thefhfoundation.org. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan. Almost 1 million Americans will experience shingles this year.
Shingles is a painful skin rash that occurs typically over one side of the body and oftentimes occurs with blisters. People over the age of 60 are at a higher risk for developing shingles, and anyone that's ever had chickenpox in their life is at risk.
Shingles can lead to complications including eye problems and continued nerve pain after the disease has run its course.
The vaccine is about 50% effective in preventing shingles from occurring in a patient, but oftentimes those that do develop shingles after receiving the vaccine have a much milder case, so they aren't having the severe nerve pain that oftentimes our patients will complain about receiving after the shingles rash is cleared up.
Anyone with immune system problems should avoid getting the vaccine.
So anybody over the age of 60, it's recommended that they get the vaccine one time in their life. They should not get the vaccine if they've ever had an allergic reaction. And when I say allergic reaction, I mean a severe allergic reaction to gelatin, neomycin, or any other component of the shingles vaccine.
The only way to reduce the risk of shingles is to get vaccinated. If you experience pain or irritation at the injection site or develop a high fever, you should contact your doctor. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan.